On May 2nd, 2025, Crozer Chester Medical Center and Taylor Hospital in Delaware County ceased operations. In addition to leaving a county of over 500,000 people with only 2 acute care hospitals available to care for their needs, over 2,600 nurses, physicians, food service, environmental staff, technicians, therapists, administrative staff, and EMS professionals lost their jobs. The damage left in the wake of Prospect Medical Holdings, a private equity group from California, and their disastrous foray into healthcare in the Commonwealth of Pennsylvania endangered the lives of nearly 500,000 children and adults while generating personal wealth for a handful of executives and shareholders. Their actions hurt communities and took advantage of Pennsylvania taxpayers who helped keep the system afloat while the shareholders and owners watched and counted their bounty from afar. Sadly, Delaware County is not alone in experiencing the devastation brought by a health system closure. In the past 5 years, our Commonwealth has lost 26 nonprofit and for-profit hospitals. 46 have changed owners. As hospitals struggle to cover costs in the face of stressors like low reimbursement rates, coupled with the growing cost of doing business, increasingly they seek buyers for financial relief, access to capital, and operational support. But many times the trade-off is lower quality patient care and the loss of long-term stability. The Health System Protection Act is the result of a fully collaborative process with many stakeholders, all moving toward the one goal we all agreed on: protecting healthcare access in Pennsylvania. While House Bill 1460 is not the answer to all the issues our healthcare systems face, it is a first step toward addressing the issue of for-profit and private equity transactions in healthcare facilities. Most notably, it provides our Attorney General with the tools needed to review transactions prior to being finalized and provides for ongoing monitoring to ensure that these transactions are not against the public interest. It will allow our Attorney General to evaluate these transactions to ensure there is no unfair competition, a reduction in quality of care, reduction in access or availability to services, minimize the impact on our already struggling rural, low-income, and disadvantaged communities, and most importantly, provide a process to evaluate potentially damaging healthcare leaseback agreements, the ultimate blow which led to the demise of so many health facilities in our Commonwealth, like Crozer Health and Hahnemann. It will also allow impacted communities to have a say in the process. In short, House Bill 1460 would strengthen Pennsylvania's ability to protect healthcare services, ensure community access to hospitals, and limit the negative impact of private equity transactions on public health. It represents a significant step toward regulatory oversight of healthcare consolidation and financial transactions in our Commonwealth. I'm grateful to the Senate's Institutional Sustainability and Innovation Committee staff, that is a mouthful, that committee, the administration, and the bipartisan staff of the House Health Committee for their work to help bring us closer to realizing significant protection for our hospitals. I am optimistic we can act together to prevent the narrowing of the legislation and from allowing another health system to fall prey to bad actors who see the residents of our Commonwealth not as people to be cared for, but as profits to be made.